the beginning of 2020, no one could quite imagine what was about to happen. We had plans and aspirations, and we were about to embark on some big projects. But soon after the beginning of the new year, it became obvious that something big was about to happen. This is the story of our COVID journey, the highs, the lows, the achievements and the innovations, the collaborations and the friendships. I hope you'll enjoy watching it and agree with me that the achievements of our staff have been truly remarkable in the face of adversity, and we've much to celebrate and even more to look forward to. One advantage was that we had the advance warning of what we were about to face. Although we couldn't truly know what that would mean, it meant we could prepare. We were able to suspend services and train staff in the management of ventilated patients, advanced airways and proning. And for our anaesthetists and theatre staff, that became reality as they were redeployed to ICU. We also rearranged services at a rate far greater than ever before, introducing new ways of working, sometimes in a matter of hours. We moved staff and services to other sites and into the private sector to make ready for predicted high volumes of COVID patients. Our day surgery unit became an elective surgical ward, our outpatient clinics became ambulatory care areas, and our A&E split into a hot ED at one end of the building and a cold ED at the other. Our surgical assessment unit opened 24/7, and ICU expanded up to 3 times its usual size at the height of Wave 2 and maintained this pressure for many months. Therapy colleagues extended services and provided nurse tracheostomy training for HMU staff. Our neuro-rehabilitation unit moved to a private rehabilitation establishment, and wards used to providing elective and day case care became repurposed to become inpatient wards caring for sick COVID patients. Colleagues on our other hospital sites worked flat out to release pressure on the Reading site so we could focus on COVID care and high acuity non-COVID care. We benefited from having moved our community paediatric clinics to a purpose-built building on the University White Knight site just a few months before the pandemic, as this enabled us to reorganise paediatric services. All of this was possible because of our staff, which included our housekeepers, whose endless deep cleaning minimised cross-contamination, our infection prevention and control team, who reviewed endless national guidance to make sure patients and staff were kept safe, and our porters who lifted our spirits with their good humour as they split into duplicate and then triplicate teams to service all the relocated services. Our clinical admin teams who booked and rebooked appointments and were often the first contact for scared and anxious patients, and many more staffing groups and unsung COVID heroes. And they all did this despite their own anxieties for themselves, their families and loved ones in what had become a rather frightening world. And we were also helped by so many people outside the organisation, from donations of scrubs made by local sewing bees, food from local retailers, hand cream and toiletries, it just kept coming. In fact, we had so many donations that we established a staff health and wellbeing hub so we could distribute all the goodies as well as provide a hot drink and a meal and a safe refuge to sit and relax, to contemplate and to reflect, and this was all manned by volunteers. The health and wellbeing of our staff was vitally important, ensuring they were well cared for so they could care for our patients. Groceries were hard to come by after a long working day, and transport to work was limited during lockdown. So we established a hotel in the grounds of Reading Boys School where 40 sleep pods enabled staff to rest between shifts, and a pop-up supermarket ensured those going home had access to well-needed sustenance. The provision of additional parking spaces on the university site meant staff could travel to and from work in their own transport. And our staff didn't go untouched physically as well as emotionally. Sadly, we lost 2 members of our family to COVID, and more were seriously ill, needing our services, colleagues caring for colleagues. And in those darkest times, we did what we do and what we're good at. We worked hard, we created and we innovated. We established a raft of virtual clinics, accelerating our digital programmes at warp speed. At the height of the pandemic, 70% of our outpatient services were provided remotely. our IT team providing equipment, systems and training so staff could work off-site reviewing patients by phone, video link and using patient-initiated follow-up. Our ambulatory care team established a virtual ward for Covid patients who didn't require inpatient treatment but instead benefited from outpatient monitoring of their oxygen saturations in their own homes. A dedicated team assessed them and provided daily contact and monitoring until they were well again. This TIC-19 virtual ward cared for nearly 1,500 patients, and this model of care has been subsequently adopted up and down the country. Like other healthcare establishments, we were faced with a real shortage of essential equipment. Firstly, PPE was in short supply. We were donated a vast amount, and in order to assess this to see whether it could be safely deployed to staff, we established an innovations committee. This group's sole purpose was to get stock to staff if at all possible, and they reviewed kit against national standards and decided if it could be used in high and low risk areas, ensuring very little was disposed of. They moved on to reviewing novel equipment and innovations, and whilst not all of it made the grade, much of it did, helping to ensure we never ran out of vital PPE. Our lead orthotist, used to fashioning orthotics, braces and specialist footwear, turned his hand to visors, setting up a production line in his own home, ensuring we had a surplus and could even donate these to other healthcare facilities. One thing that was in very short supply, in fact ran out nationally, was fit testing fluid. This vital liquid is used to test the seal on FFP3 masks. These masks are essential, ensuring staff can safely care for Covid patients whilst minimising the risk of inhaling viral particles. Without this, we couldn't ensure our staff were safe. Our university colleagues came to our rescue, with your lab staff producing it for us by the VAT load. And this was especially important as we had to keep retesting staff as so many different types of masks were delivered daily. As it became clear more and more patients were requiring non-invasive respiratory support, we began to run short of respiratory circuits for them. Our clinical engineering team set about repurposing equipment to ensure we had enough. This involved adapting and redesigning breathing circuits and systems to support patients, preventing the need for them to go into intensive care. Oxygen was also in short supply, with a number of hospitals running at critically low levels. Faced with inconsistent supplies and an aged delivery system of antiquated pipework, we took the decision to install an oxygen concentrator, one of only a handful to be put into a mainland UK hospital site. This was achieved by collaboration between the suppliers, our estates team and colleagues at the university. As a research active organisation, we were keen to contribute to a growing body of Covid research. Although many of our non-Covid trials were suspended and a number of our research staff were seconded into clinical areas, including ICU, we were able to contribute to 9 of the big Covid studies, recruiting nearly 4,000 patients. That put us in the top 10 of hospitals recruiting. In particular, we recruited 365 patients into the landmark recovery trial, which has and continues to guide treatment of Covid. And we even managed to recruit over 4,000 patients into non-Covid trials across 2020 and 2021. And we weren't going to be left behind on vaccines either. Although we did make ourselves available for the vaccine trials, we weren't called upon. However, when vaccine became available for staff, we sprang into action, repurposing a disused part of our pathology department into a vaccine centre. Probably the quickest build project we've ever done, and it was all hands on deck to ensure we were ready before our first delivery. The vaccine centre quickly became the endorphin unit for the trust, the place to go and feed off positive vibes from staff, a sense of hope and a new future. To date, the vaccine centre has delivered over 10,000 first and second doses and has already given over 1,500 boosters. And as well as providing for our own patients, we contributed to national Covid responses by establishing one of the lighthouse testing laboratories on our Bracknell site. We recruited over 400 staff who test 400,000 Covid swabs a day, vital in preventing the spread of the virus. And in the midst of this, we also had the builders in to expand our ED so we can see more patients in majors and minors and provide a more roomy waiting area and point of care testing suite, enabling patients being admitted to be tested for Covid. This ensures we can stream COVID-positive patients onto the isolation wards, whilst those without COVID can be safe and free from infection. Due to a generous donation, we've also been able to renovate a listed building on our site and convert it into a permanent health and wellbeing centre for staff, a place to relax and recuperate during a working day or use the donated gym equipment. Alongside this is a cycling village encouraging staff into a green, lower carbon commute, providing storage facilities for bikes and showers and changing areas, all encircled by a memorial garden for some peaceful reflection time. As the number of acute COVID patients came down, we turned our hand to caring for patients with long COVID by establishing a long COVID clinic, one of the first in the country. This multidisciplinary service assesses patients struggling with symptoms after their acute illness and triages them to appropriate treatment to enable them to maximise their recovery. This service has now seen over 900 patients. And with all of this going on, you could have forgiven us for thinking we'd forgotten about caring for other patients with other illnesses. But that's not the case. By segregating and streaming patients smartly, moving services off-site and utilising virtual clinics wherever possible, we were able to keep going with non-COVID work, albeit at a lower level at the height of the pandemic. This did mean that we came to the end of Wave 2 with much lower waiting lists than many other trusts. Of note, we were able to keep cancer care going throughout the entire pandemic, meaning patients undergoing investigations and treatments were able to continue their journeys, so important for them at such an anxious time. And now those same services are working in overdrive to catch up and manage additional patients coming through. From the start of the pandemic, we established a drive-through swabbing service so patients could be safely screened before their planned procedures. Our endoscopy department is operating 120% of its usual activity, and our theatres are working at full capacity in order to minimise waits for treatment. So that was the year that was, and what a year it was. I hope you'll agree that we've had a remarkable 18 months, and it's due to the hard work and determination of our people that we've not only risen to the challenges of the pandemic, but we've also seen and seized the opportunities that have presented themselves. The next 18 months are likely to be equally hard, but for different reasons, and I've no doubt we'll be ready to meet the next set of challenges head on, continuing to provide great care for patients and a great place to work and learn for our staff.